Welcome back to True Vine Talks with Rachel and Linda. We hope that your weekend is going well. And today our topic is going to be, what's that, Rachel?
What is counseling or therapy? So we'll talk a little bit about what credentials a counselor has to have to practice, what to expect your first time you come to counseling. It's called an intake session. We'll talk a little bit about what happens then, and then we'll discuss what to expect from a good counselor or therapist.
Yeah.
So, Linda.
Yeah.
How do you become a counselor?
Oh.
For anyone out there wondering.
Yeah. So,
Maybe we have some future counselors listening in.
yeah, we might have some future counselors on the rise wanting to come work here at True Vine. So in order to be a counselor, you have to have post-bachelor's degree, a master's degree in mental health school counseling. You know, you could have the dual, which is what you did, right? You did the dual.
Yeah, so my bachelor's is in psychology, and I have a master's in counseling.
There we go. And so once you have done this postgraduate work in your master's program, you have to, go under supervision with, a licensed ALPS counselor, approved supervisor by the board. And you're in that process for about 2 years.
At least, yeah. I feel like mine's taking forever. And I actually get a lot of questions about licensure from my family and friends that aren't as familiar with counseling. So it's not, you can practice counseling as a just with a master's, but really to work in private practice and improve your skills, and further your career, you want to be licensed. And so that is a big application process. You fill out a lot of paperwork, submit it to the state board of examiners in counseling. They review it, and they'll give you a, what is it called? Provisional license, which is what I currently have. And then you have to have 3,000 supervised hours, which is what I'm working on now with Linda, my wonderful ALPS.
Aw, thanks, Rachel.
Yeah.
You've been a great counselor to supervise, very motivated. And so, Rachel's been in this process for a while. She already had the skill set, but being an LPC requires more. So, she's got the 3,000 hours. Once she does that, she'll have her LPC. She already has her NCC. And she's good to go. She gets her own MPI number, and that is, your number for billing the outpatient services. So I don't have to go into all that for you guys, but just to let you know that you can't just be anybody run-of-the-mill out here practicing counseling. Counseling is a unique art. Wouldn't you say it's a unique art, Rachel?
Yeah.
How would you describe counseling?
I always tell people that a good counselor is theory-driven. Mm-hmm. So we're not just sitting in a room talking to people. We're not just good listeners. We've studied and learned these psychological and counseling theories. So there's a part, in the back of our brain as we're listening. Mm-hmm. I'm thinking, okay, what stage of change is my client in right now? How motivated is my client right now? Is my client ready to, discuss some trauma that maybe happened in their life? And what kind of bond does my client have with the most important people in their life? What types of stuff go through your mind as you're in session?
That's all very good. Yeah. You said that very well.
Oh, thank you.
Yeah. So as a counselor, you're sitting here observing, the behavior of the individual? Are they moving? Are they squirming in their chairs? They're telling you the story. They're
Yes.
tapping their foot. Do they look down? They can't make eye contact with you. So you're really about being in the present moment with your client. Do they seem agitated? You know, what's going on in their affect?
Yes.
Do they tell you they're happy, but their affect says, I'm sad, really?
Yeah.
You're attuned to the person's body language that they're not sharing. And I practice more of that present moment, the existential and experiential process of counseling. And when you have a sit-down coffee chat with your friend, you're not really looking at them in that way, nor really should you be.
Right. It takes a lot of energy to do that. So I would hope if you're just sitting down with a friend, you're much more relaxed. And
And even in our supervision, we've become more relaxed with each other. We've built the bond. And now we can just sort of bounce off these ideas from each other. And it's not as tense as in the beginning where we're trying to see where we're at.
Yes.
What's the path we're taking here? And, we've built that rapport. So, in a counseling session, you're not chit-chatting about politics,
Right.
religion, or weather. It's not about those things, the latest. Now, those things can come up like, hey, nice, beautiful day outside. Yeah, it sure is. You're going to go outside and catch some sun. Sure, that might come up. But that's not what you're doing. You're not probing for the latest news.
No, there's a purpose to the conversation. So my client has a goal that we've nailed down probably from day one during that intake session. I want to be more confident, or whatever, you name it. So the conversation is always driven by that goal. Okay, you want to be more confident. What's preventing you from being confident? Okay, you're insecure about this, and this. Where does that stem from? When did you first notice that? So very goal-directed conversation versus just chatting with a friend. You're here, there, and everywhere.
Very valid, very good points you make. Your goal is in mind. So, and I think you said this well in one of our supervisions, even though you're hungry, you personally as the counselor, you're hungry or you're thinking about your day, all of that is put on the back burner. Is that how you said it?
Yes, we did talk about that together, didn't we? About how I, as the counselor, for that 45 minutes or that hour that you are with a client, you put your own needs aside. I'm putting all my needs, whatever's going on in my life, on the back burner, and it's all about you and how I can help you. And I want to reach for you and let you know that I'm here.
Yeah. And sometimes clients take that personal. They think, oh, why is Rachel withholding? Where's her human side, But we've been trained to be present for you. It's not like a social exchange like you and I were talking about earlier. You scratch my back, I'll scratch your back.
Yeah.
You're coming to us. You are paying for a service for us to make it all about you and putting our own unmet needs, survival, physical, emotional, whatever we got going on, bills. We're putting all that aside, and you're paying us to be just about you. So it's not a personal thing like, oh, I gotta withhold, I'm not being open with you. It's about a skill set we're using.
Yeah. Well, and I also think that it's us, having a professional relationship with someone. I may disclose occasionally, but it's only going to be those times when it's appropriate. You know, this person is feeling really bad because at the end of the day they're tired and they don't go out and hang out with friends and they've isolated themselves and they just watch a lot of Netflix. And I can say, you know what? You work really hard. And sometimes when I've worked a really hard day, I go home and watch Netflix too.
Yeah.
Right? So don't feel like you're the only one, right? But if you're not happy with that, what do you want to do about it?
Very well stated. And that's your door in to make yourself a real person, personable. Yet you're not trying to use your client as your sounding board.
Yes. I'm not drawing you into my drama and my problems, but I'm sharing, you know what, I get it. I've been there. It's just validation for them.
Yeah. Exactly. So yeah, that's helpful for the client to know, is that when we're not, like, they start asking us questions about us, we're not being withholding or guarded. We're being professional in that we are here for you.
Yes.
And where else can you go and someone sees you, observes you, notices everything about you, and makes it all about you?
I can't think of anywhere else, really. I think that's the unique, awesome thing about counseling.
Yeah. I mean, who wouldn't want to come see us here at Truvine and just, it's all about me. It's about what my unmet needs are, my wants, my hopes, my desires. And how are you going to help me get there, Rachel?
Yeah.
It's a beautiful
I
thing.
love it.
Yeah.
And I hope we're not, making folks that haven't been to counseling perceive that it's a selfish thing to do. Like, basic human need is attention, belonging, feeling worthy. And so, when we're being attuned and just present with someone, that's what we're providing. We're saying, you are worthy of my attention. You are worthy. You deserve to be happy. Let's help you get there.
Yeah.
We're meeting basic needs that often go unmet by people.
Yeah. That's beautiful stated too. Yeah. That's right. So, maybe your family's so busy that they don't have time to give you that undivided attention. Well, we can offer you that.
Yes.
And that's a beautiful thing, because that is an unmet need.
Yeah.
The basic human desire is to be seen, to be wanted, to be loved, accepted without judgment.
Yes, I'm so glad you said that, accepted without judgment, because that's another really big thing that makes counseling different from talking to, a friend or family or whoever. This is non-judgmental, non-biased space. So those conversations that you want to have with your best friend, but maybe you're worried about what they would think about you if you did, you can bring them up here with us.
Yeah, like if you smoked weed last night and you didn't want to tell anyone, you can tell us, because it's confidential.
Exactly. Or
non-judgmental.
Or you're having some, discord, some fighting with your significant other, and you don't want anyone to know. Maybe you're feeling a little troubled.
Yeah. And how come you would want to talk to a counselor about your discord with your significant other versus your mom?
So we're going to know how to kind of figure out, okay, what's going on here, and is this salvageable? Whereas, mom might give you some advice that helped her with dad. And counselors, we don't give a lot of advice. Rarely ever give advice. I want my client to figure out what's right for them on their own. And I'm just here to help them get to that conclusion.
You're their God.
Yes.
You're their Yoda.
Yeah. I like that. I'm the Yoda.
Yeah, we're their Yoda in life. And mom's going to be like, well, how dare you let him treat you that way? It's time for you to get a divorce.
Maybe. Yeah.
Or you need to just kick him to the curb if your best friend's like, how come you let him treat you that way? That's the kind of conversation you're going to get with lay people. And when I say lay people, I mean like your friends, your family.
Coworker, whoever.
Yeah. And that's not what we do.
No.
So if you've went to a counselor and they're talking this way, it's not the best counseling. Even in my early years in counseling, I was always confused about my own core beliefs and how to be present for someone when they'd ask, like, should I leave this guy? I mean, he's cheating on me with 3 girls. And I'll be like, oh, man, I don't know. That's hard for me to... You're asking me a question that at my core, I'd say, yeah, dump the guy, go on. But then really, it's like, no, that's not what they're really asking. They love this person, and they've betrayed them, and they're hurting, and they want me to be present for them. They got to make the decision whether they can forgive that guy or girl or whatever. It's not up for me to impose my core beliefs on them.
Right, yeah. And that's where one of the hardest questions is, well, what would you do?
Oh, yeah.
I'm like, this isn't about me. This is not my life. I don't know.
Yeah. That is a question that often gets asked of us. Well, what would you do in this situation? Well, I don't know, because I'm not you. I haven't been through the trauma you've been through. I haven't experienced the pain you've experienced. Your truth is your truth, not mine.
Right.
My beliefs are my beliefs, not yours.
Yeah. We have completely different experiences, values, beliefs.
Yeah. So we're just the guide to help them find their inner truth, what's going to work and make them be healthy, have a vision for their life, what they want and desire, and how to get that met in the right way.
Yeah.
Is that helpful?
Yes.
Yeah.
Very. And I hope it's helpful to everyone listening. So, I've noticed a lot of people who haven't gone to counseling and come for the first time are unfamiliar with the intake process.
Yeah.
And it can be a little bit confusing coming in and thinking that you're going to get help and talk about all your problems, and then you leave and not a whole lot of counseling really happened. Right? So let's talk about the intake a little bit. What are some things that you like to ask and find out about people in that first session?
Yeah, first off, what brought you here today? Yeah. What can I help you with? And, they're going to share, well, I'm anxious all the time and I can't sleep at night. And so they're going to give you some symptoms. Yeah. And then you want to pry a little more. So tell me about your childhood. What was your bonds like with mom and dad? Was the household safe? Did you feel like you had someone to go to when you got hurt? We're really kind of processing the person's life history depending on their age. Like you want to know more about their upbringing.
Yeah.
Their closest bonds. Did they experience sexual abuse? Have they experienced domestic violence? Have they witnessed their parents fighting? Those kinds of things. Did they get bullied in school? What was their social life like? We're really like information gathering about their life experiences, their bonds, their experiences with others.
Yeah, because we know nothing about this person. So we're trying to, paint me a picture. Who are you? What have you experienced? What have you been through? And we'll also talk about, where do you hope to go from here? What are those goals? As you said, what brings you to True Vine, right? That's the purpose. And obviously, if I've been feeling really sad lately, the goal is going to be feel less sad.
Yeah. What is your deepest, most inner value? I want to know. What drives you? What makes you want to get up in the morning? That's important to know. And that goes back to some of that motivational interviewing stuff is, if I don't know what your values are, I can't help you develop committed actions for those things.
Right.
Yeah. So you're like opening the door to their house and seeing all the floors from childhood to where they're at today.
I love that image. It's a good one.
You like it?
Yeah.
Yeah. And, and it's scary to sort of reveal a lot the first time they meet you, and that's okay because we can fill in the blanks.
Yes.
As we go. But we want you to come in and feel like you can just share your life with us. And we'll ask some pertinent things like, what medications have you been on? What medications are you taking now?
Mm-hmm. Have you had any past mental health or psychiatric treatment?
Yeah.
Yeah.
Any physical problems that might be causing you to feel this way? Are you seeing a doctor for those things? If not, let's get you acquainted with a family physician.
Absolutely.
Because we deal with the mind and the heart. TrueVine does. But the physical is, you want to get an outside provider for physical or for medication management. Mm-hmm. So if you can't manage your symptoms of anxiety or depression, we will encourage you to go seek. What do we usually ask them to go do?
If they can't manage their anxiety and depression,
we
may refer for them to go see a psychiatrist for medication, do a sleep study, see if they're sleeping okay, see a nutritionist, get their diet on track, a doctor to have a physical done, make sure there's not any problems going on in their body.
Yeah.
Any number of things. Anything that's going to be helpful in making them the best person they can possibly be. We want to make sure we're checking it off the list if symptoms persist.
I like it. Because, we want to know that their physical is intact. And if it's not, they need to have that addressed outside of TrueVine. Because you're a whole person, mind, body, soul. So, we at TrueVine want to help you with, figuring out what the presenting problem is, and how you want to go about alleviating that problem, and how we can best help with that, whether that's interpersonal or intrapersonal. I always get those two mixed up.
Me too. Yeah.
Is within, without.
Yeah.
Yeah. Showing my weaknesses here. So, a lot of times it is you're having problems with your interaction with the person that matters most. Mm-hmm. And that goes back to Sue Johnson's emotionally focused therapy, which you and I practice quite a bit. So, and that tends to be the model I lean towards. What's the model you lean into most, Rachel?
The more I learn about emotion-focused therapy, I am leaning into more and more. A lot of times with kids that don't really have the insight yet, their brain just hasn't developed, the areas necessary to talk about attachment bonds and things like that, I will revert to CBT, cognitive behavioral therapy.
And that's using your wisdom in your toolbox. Yeah, good job. So see, as counselors, we're assessing you where you're at developmentally, where you're at emotionally, to know what road you're trying to take. So we're doing a lot in session that people don't know.
Yes. There's a lot of chatter going on in our brains while we're still listening.
Yeah. But hopefully we're just trying to be present for you as a client, and you feel seen, heard, accepted, loved, and non-judged, or you're not being judged when you come. So
yeah, all of that's number one. If I'm not doing that, I'm failing.
As a
My
counselor,
clients.
yes. I mean, yeah, if you go to a counselor and you walk in and you feel like they're judging you, they may need to go get some supervision or go back to, this basic skills of positive regard, unconditional regard for the person, open acceptance for where they're at, in whatever stage of life they're in.
Yes.
Is that helpful?
Yeah, I think so.
Yeah.
It's the approach that you use comes first, and then theories kind of lead from session to session.
Yeah. And another big question is, well, how many sessions?
Ooh,
Rachel?
that isn't a good question. Yeah. And I'm not really sure how to answer that a lot of the time with clients, because it's a case-to-case basis. Some insurances will limit sessions. So that's a discussion that we have. It's like, well, we'll kind of see where it goes. Let's check your insurance and see how many sessions. Is it 10, 25, whatever? And I think really clients, you probably usually know, and counselors as well, we know when our client is ready to spread their wings and have their case closed. But counseling does take time. It's not something that, we're not going to resolve your childhood traumas in 10 sessions, probably.
Because another block will come up for you.
Yeah.
Yeah. And, you'll have a trigger to an experience and you didn't even know it was there. So you may need to come in and process that and help us frame it for you in a way that helps you cope with those triggers.
Yes.
And I tell couples, because you and I are, we're towards that goal of doing couples and family using EFT and EFFT, which is emotionally focused family therapy, is that takes a lot longer, depending on what types of attachment injuries happen in your relationship or what's going on in the family. Those can get chaotic. So there's 9 steps and 3 stages to EFT in helping the couple. And, people stay in stage 1 most of my couples stay in stage 1 for about 10 to 15 sessions.
Okay. So you
Some
gauged
longer.
that?
Yeah, it seems to be the gauge. Then when we restructure their bond and we create those good exchanges, that could take probably 10 more sessions. And then the last stage is when we come up with new solutions to their problems and that kind of thing. And they start doing it on their own as a couple, and that can take 5-6 sessions. But what happens usually, sometimes there's another injury that shows up and we go back into stage 1. So maintenance is always helpful. So, you just keep your counselor on the back dial.
Yeah.
Because, hey, something else showed up. And your case isn't necessarily closed. We're still accessible to you. You may not need us right now.
Yeah.
So that's helpful. But couples takes 2 to 3 years sometimes, depending on how many injuries happen. And you don't learn this attachment language in 2 sessions.
No. And so that's another thing I was hoping we would talk about is, the length of time it takes depends a lot on how willing you are to participate in counseling and whether you're using the skills that you're learning outside of session or not.
Yeah. How come it is important that a client practice what they learned in session? Did that take you by surprise?
No, I'm just like, how do I not ramble on about this for hours? So in session, you're seeing a counselor, all right? You're paying to have that person teach you the skills to do life. The way that, to get you to where you want to be. So if you're only practicing those skills for an hour a week, an hour every other week, and then you're not using them in real life situations, you're not going to be making any progress. If you just revert back to your old habits when you're not in my office, I'm not really sure what we're doing.
Yeah, that's true. So, like, if I have someone that can't assert themselves and they come in and they're always complaining about this significant other or boss that takes advantage of them or uses them, and I teach them how to, use language to assert their need or to push a boundary that needs pushed back, or set a boundary with someone that needs to be set, and then that doesn't take place, we will process that. So what's happening for you when you go to say no to this person? We dig deep. So if you're struggling with asserting a boundary outside of session, when you know that's what you need to do, we're going to go a little deeper into that and find out what's the block to saying no to someone when they're hurting you.
And I'm sure it's fear.
Fear? Yeah.
So, and it's normal. People are going to be scared to do things differently because we like the comfort of what's known to us, and staying with, okay, what can I know if I do this, I can expect this to happen. That's very comfortable to me. It's reassuring. But you're not happy with those results. You're not happy with your life and where these old habits are getting you. So you're going to be scared. Be scared and do it anyway.
Yeah, I like that. Be scared and tell your mom, no, don't come over on Saturday. I didn't invite you. I'm trying to rest.
Yes.
Tell your boss, no, I'm not taking on one more of your projects today. You can do that yourself.
Yes.
Now, is the potential to get fired? Yes. Are you having upset stomach, anger, and depression? Yes. So, learning how to say no to people and do it afraid, that's a big deal. That's a big deal. That's where we come in and coach people about, so sounds like, your mom takes advantage of you sometimes. Sounds like when you have interactions with her, you leave feeling kind of yuck. Is that it? So I'm wondering if, there's a part of you that says, I really need to tell mom no. I don't want her to come over and ruin my Saturday talking about her, problems with her dishwasher. Whatever it may be. And people fear hurting other people's feelings, but they have an unmet need to rest and relax and do what they need to do. So I think coaching boundaries and practicing that outside of session is the hardest thing for clients. Yeah. Is that helpful?
Yeah.
Yeah. So if you're not practicing assertiveness outside of your 1 hour session with us, you won't see results quick. But we can process that. What's happening when you go to say no, or what's happening when you share that you need them to be closer to you. We want to help people do it scared, like you said.
Yeah. And we don't expect someone to, after, 1 or 2 sessions, be out there telling everybody, no. I mean,
we like that.
We have realistic expectations for what you're capable of. But it's important for everyone to know that if you are going to go to counseling, you need to be motivated and ready to change some things that you're not happy about, right? Because if no change is made, nothing's going to be different.
Yeah. We wish we had a magical wand that we could put to your mouth to say no when you need to, share what your needs are with your significant other when you need them. But we do a lot of work, deeper work about that emotional stuff that happens that you don't even know is happening.
Yes.
We just don't have a magical wand to fix things.
I actually have like a fake plastic one that I'll pull out in those moments. Like, I really need to get my money back because this doesn't work. All right. So we're going to have to, you know.
Yeah. So coming to Truvon is really about coming to see someone who can see you, accept you, be present for you, and be your guide in your journey. And whatever your problem is, we're helping you find your own internal solution. Is that how you would describe what they're going to get?
Yeah.
Would you like to add more to what you think our clients gain from coming to us?
I think just building a positive alliance and knowing that even if no one else understands what you're going through or no one else has your back, you know, we do. Right? And we're here to support you and encourage you and remind you that you're worthy, important, and you deserve to be happy.
Well stated. So we would love for you to come and see either myself, Linda, or Rachel for counseling. Again, we do couples, family, individual. We see kids, teenagers from ages,
5 and up.
5 and up. We work with all ages, and we want to help you become your best self and have your best bond that you can possibly have with your significant other or your family members. So if you're interested, you can give either Rachel or I a call, and we'll be happy to get you guys scheduled. So thank you for joining us again with Truvon Talks with Linda and Rachel.
Bye.
Bye.
Until next time.